Hi everyone, welcome back to my YouTube channel, and today we are going to talk about antipsychotics. So let's start our topic with introduction. Antipsychotics are a class of psychotropic medications that are used primarily to manage symptoms of psychotic disorders such as schizophrenia, schizoaffective disorders, bipolar disorder, and severe depression with psychotic features. These drugs work mainly by altering neurotransmitter activity, particularly dopamine and serotonin within the brain. They help to reduce hallucination, delusion, agitation, and disorganized thinking. History and development of antipsychotics. Antipsychotic medications were introduced in 1950s, beginning with the chlorpromazine, which revolutionized the treatment of psychosis. Over time, antipsychotics have been categorized into two major classes. One is first generation antipsychotics that are also called as typical psychotics that were developed in 1950s to 1970s time. Second class is second generation antipsychotics that are also called as atypical antipsychotics. They are developed from 1990s onward. The newer atypical antipsychotics were created to reduce movement-related side effects seen with typical drugs and provide broader symptoms control. Classification. We know that it's divided into two classes. First is first generation antipsychotics and second is second generation antipsychotics. First generation antipsychotics that are also called as typical antipsychotics. These drugs primarily block dopamine D2 receptors. Examples include chlorpromazine, haloperidol, sulfenazine, trifluoroperazine, perfenazine, and its key features include it is effective for positive symptoms like hallucinations and delusions. It is for the high risk of extrapyramidal side effects, and there is less effect on the negative symptoms. Second generation antipsychotics are also called as atypical antipsychotics. These block both dopamine D2 receptors and serotonin receptors. Examples include risperidone, olanzapine, quetiapine, clozapine, aripiprazole, ziprasidone, and their key features are they are helpful for both positive and negative symptoms. They lower risk of EPS compared to typicals, and there is a high risk of metabolic side effects like weight gain and diabetes. Mechanism of action of antipsychotics. First is dopamine hypothesis. Psychosis is thought to be linked to excessive dopamine activity in certain brain pathways. Antipsychotics reduce dopamine transmission by blocking D2 receptors, especially in the mesolimbic pathway. Second mechanism of these antipsychotics are serotonin dopamine interactions that are by the atypical antipsychotics that are second generation antipsychotics. Atypical antipsychotics act on serotonin receptor that improve tolerance and reduce EPS, and D2 receptor that reduce psychotic symptoms. Third mechanism of action is their effect on brain pathways. First is mesolimbic pathway effect that is responsible for positive symptoms. D2 blockade reduce hallucination and delusion. Second pathway that is affected by antipsychotics in brain is mesocortical pathway. It is involved in negative symptoms and cognition. Atypicals may improve functioning of this area. Third effect on brain pathway is nigrostriatal pathway that control movements, and D2 blockade can cause EPS. Therapeutic uses of antipsychotics. First is psychiatric condition that includes schizophrenia, schizoaffective disorders, bipolar mania, severe depression with psychotic features, delusional disorders, acute agitation, and it is also has therapeutic uses in non-psychiatric disorders that include Gilles-de syndrome, severe nausea or vomiting, Huntington disease that is used for control of symptoms, and intractable hiccups. Chlorpromazine is given in that case. It also has therapeutic effects in extrapyramidal side effects, as it is more common with typical antipsychotics. It causes acute dystonia, akathisia, Parkinsonism, tardive dyskinesia, that is long-term effect. And then it has metabolic side effects. Antipsychotics metabolic side effects include they are more common with atypical antipsychotics. and they include weight gain, hyperlipidemia, and diabetes mellitus. First, we will talk about their therapeutic effects. Now, we will talk about their side effects that were included extrapyramidal side effects and metabolic side effects. Their therapeutic effects also include endocrine effects that they can also cause hyperprolactinemia, sexual dysfunction, menstrual disturbances, and then they also have cardiovascular effects as they can cause orthostatic hypotension, QT prolongation, and these antipsychotics have other side effects that include sedation, anticholinergic effects that include dry mouth and constipation, and neuroleptic malignant syndrome that is rare but life-threatening condition. Special consideration in case of antipsychotics. First, their use in children. It is used cautiously as it is mainly served behavioral disorder or early onset schizophrenia. It is used in elderly that include high risk of stroke and mortality in dementia patient. Dose reduction is often required in case of elderly people. The third we'll talk about its use in pregnancy and lactation, as some antipsychotics are safer than others and this must be weighted against untreated psychosis. Monitoring requirements of antipsychotics. Patients on antipsychotic require ongoing monitoring including weight and BMI check, blood glucose and lipid profile, liver function test, ECG for QT interval and prolactin levels, and also screening for APS. Conclusion of this lecture video. Antipsychotics are essential medication for treating psychotic disorders and severe other psychiatric and medical conditions. While they effectively reduce symptoms like hallucination and delusion, they also carry significant side effects, especially involving movement disorder and metabolic changes. Careful drug selection, dose monitoring, and patient education are crucial for optimizing treatment outcomes and enhancing quality of life. And this was all about antipsychotics. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.